Alrighty, well, good afternoon and welcome everybody. Thank you for joining us today. My name is Andrew Doffney. I'm the Instruction and Outreach Librarian at the New Jersey State Library, and it is my pleasure to present our two presenters for today from the Alzheimer's Association. Nicolette Vasco is going to be serving kind of as a support person today, but our person who's going to be leading the presentation is Ronald Perez. He is a retired bench scientist who spent 3 years conducting basic science research in the areas of oncology and endocrinology at Weill Cornell Medical Center. Ron's most recent experience was with Terumo Medical Corporation as a market research and analysis, where he helped Terumo's injection business identify potential areas of business opportunities. He now volunteers with the Alzheimer's Association as of October 2021 and is looking forward to contributing his scientific, academic, and industry knowledge. So welcome, Ronald and Nicolette. Thank you for joining us today. Before we jump into today's program, just a few housekeeping items to go over. First and foremost, we will be taking your questions at the end of the program today, but please feel free to submit them at any time using the Q&A or the chat feature in the Zoom dashboard. They have provided a few handouts and flyers for today's program. I will make sure that those get added to the chat once we get underway, and you should be able to download them from there. If you do have problems downloading them, do not worry. They will also be available as attachments in a follow-up email that I'm going to be sending out. There will be a survey available after the webinar as well as in the follow-up email. We ask if you have time, please complete the survey. We love hearing your feedback, and it really does help us as we move forward with our programming to make sure that you're getting the best possible information. And as always with Alzheimer's, if you're looking for more information about the disease, about care, treatment, and things like that, there's no better place to go than the Alzheimer's Association. And you can see their web address on the screen there. And I will send that out in the chat as well so that you have a live link. For those of you who might be new or unfamiliar with Zoom, I just want to go over the Zoom dashboard to make sure that everybody is good to go. First and foremost, this is what your dashboard should look like if you're using a PC or a Mac. If you're using a mobile device, the dashboard may look a little bit different depending on the device that you're using, but all of the features will still be there. Back in this down in this left-hand corner here, you have your audio settings. So that's where you can check to make sure if you're having any audio issues that it's connected to the right speakers. In the middle, as I mentioned for questioning, you have your chat and your Q&A buttons. You can hit either of them to submit us questions. And again, we'll be happy to answer them at the end of the program. And at any point, if you have any issues, you can use the raise hand button here. That'll alert me, and I will send you a message in Zoom and hopefully be able to resolve any of your problems. So that is everything that I have for you today. So it is my pleasure to turn it over to Ronald.
Oh, there you go. Thank you, Andrew. I'm going to start sharing my screen right now. Just a second. All right. All right. You should all now see the agenda.
Yep,
Essentially,
looks great.
Okay, awesome. Great. So thank you for that introduction. And yes, I've been with the Alzheimer's Association for essentially since October 1st, roughly. I certainly wanted to understand more about this disease and the umbrella of, I guess it's called dementia. This is the umbrella term of which Alzheimer's is one of the diseases. So certainly, I wanted to learn about it and essentially share my knowledge coming from a scientific background with the rest of the community here in New Jersey and abroad as well. So the three main parts of this presentation is, first, I'm going to be covering the relationship between COVID-19 and dementia. Second part is going to be providing a few tips for caregivers. And the third part would be to highlight a lot of the resources that you can find either by going through the website for alz.org or perhaps other resources that our association can provide to you free of charge as well. So with that said, I'm going to move to the next slide. Just give me a second here. All right. So with COVID-19 and dementia, we find that there's new research that has found that, in fact, there is a high risk of contracted COVID-19. Essentially, is twice as high for people living with dementia than those without it. Why is that? Now, to illustrate this point, certainly there are some, disparities that have been found, particularly in populations such as the African American populations, who are essentially at a higher risk of contracting the disease, and also those who have been affected by Alzheimer's. So with that said, they are about roughly 3 times as likely to be contacted by COVID-19, contracted by COVID-19 versus a white population, for example. Now, certainly, COVID-19 and dementia, you can see that there's that high risk. For example, if you are you forget, for example, to wash your hands or to wear a mask, which that is the case for people who are affected currently by dementia, who essentially may forget to wear the mask, or may forget to have some sort of distance between one person to the other, or may forget to wash their hands as well. Now, there, as you may already know, that certainly there's a number of ways to protect you against COVID-19. One main effort has been to vaccinate people. Now, there are a number of vaccines available. I think there's about 3 at the moment that everyone qualifies for. But the main point here of this slide is that at least those people who live in residential long-term care, most of these individuals have been vaccinated, and this has been done so, to reduce the risk of anyone at these long-term healthcare facilities to spread the disease, certainly. So that's what I wanted to mention by this slide. Now, regarding COVID-19 tips, and there's a topic sheet here that has been provided by this, not only by the CDC, the Centers for Disease Control, but also it's highlighted at the alz.org website under /COVID-19. Certainly, this is a resource that you can take advantage of, that it highlights a lot of the tips for those who are caregivers at home, and at home for their loved ones. Now, certainly there's points. If you look at the right-hand side here, for example, I think there are areas where we need some guidance on further understanding what is it that, as caregivers, that we can help our loved ones with. I think certainly one area would be to provide or highlight by putting up together signs, for example, in places that are most commonly used, such as the bathroom. Perhaps remind that person to wash their hands. It is recommended that it should be at least 20 seconds for somebody to wash their hands. My understanding is I have 2 little ones, and it's not always easy to have them stay for 20 seconds to wash their hands, but that this is what is recommended by the CDC. And also, for example, I think the CDC mentions about if you are not near a bathroom, that you can also use an alcohol-based sanitizer. Ideally, the sanitizer, if you look at the label, the back of the say how much alcohol it contains. So it should be roughly around 60% alcohol or higher. So these would be kind of the main things to keep track of. Now, I'm going to move on to the next slide. Now, so certainly the CDC plays a big role in providing guidance, right, to on a national level. Now, in this case, it is important for individuals who are living with dementia that may need support to remember all of these hygienic practices, right? So certainly washing your hands for 20 seconds, it's a must. Being able to demonstrate thorough hand washing and the ability to, or the highlighting the type of sanitizer that can be used to help this individual. Now, what is it that you can do at home, to kind of help the person that you're caring for? If, for example, you notice that there is a rapid change in confusion by your loved one, that you should contact your healthcare provider. Certainly, that's something that, a sign that you should be looking out for. One thing that you as a caretaker or caregiver can also think of doing is to ask your healthcare provider, physician, to request for a longer length of prescriptions. So, for example, I take prescriptions on a monthly basis. So essentially, I have to go to the pharmacist every month to get my refill. But there's things that perhaps, for example, you may not be aware of, but you can actually make these requests and have your physician provide a longer time for refill. So, for example, I think in my case, I did it for a period of 3 months. So every quarter, roughly, I can do this so I don't have to make multiple trips to the pharmacy. And this would be ideal because, sometimes it's an inconvenience to have to go through or depend on somebody to drive you to get your prescription refill. Also, I guess the nicer thing is that if you qualify for this, you can also get your prescription shipped to your home, but that may depend on availability. I would like to consult with Nicolette. I don't know, Nicolette, do you have any further information on this specific topic?
I would say that requests for prescriptions, if someone is ill and they need further prescription coverage, maybe checking with the pharmacist. I know that there's quite a bit of plans and opportunities, adult day, respite, what have you, that have changed their guidelines because of COVID. So there may be help if they check in the community with their healthcare provider, those specific locations that they're kind of looking for more information. I think a lot more people are currently back in office, or at least have a alternative option like Zoom or what have you, that they can follow up a little further and get more information.
Okay, perfect, Nicolette. Thank you for that input. All right. Now, this slide focuses on tips for caregivers using home-based services, right? So in case you're using somebody that comes to your home to help you provide care for your loved one, certainly you might want to take certain precautions whenever bringing somebody into your home, because that may increase the risk for spreading COVID-19. And so certainly I think this slide provides some of those steps that you should take. For example, checking the temperature of this individual that's coming to your home. And if obviously the temperature is over 100.4, that the access to or entry to the house should be denied. And the next one is asking if this person has been exposed to anyone who has tested positive. Ideally, if they can provide some sort of, test that has been carried out in the past within a day, for example, that would be ideal. Definitely, if this person, passes this screening, then they can ask them to have their hands washed immediately and often as feasible, and definitely ask them to wear a mask during the duration of their stay as well. Now, this slide focuses on tips for community-based care. So if home-based care is not feasible for you and your loved one, then certainly, let's say you have to bring that loved one to a community-based care. Oftentimes that could consist of adult centers, for example, that are within your zip code. And those community-based centers, they likely will have their own guidelines to follow, and these guidelines will be based on the CDC as well, also. So certainly, whenever you are put in contact with a community-based care center, there are certain guidelines that you have, that you must follow in order to avoid this communal risk to the rest of those individuals who are staying at this base care facility. So minimizing that risk is ideal. Next slide is, so this is for, I think, I'm mistaken, community-based care. This one is for individuals in residential care. So certainly all of these guidelines are to help reduce the transmission of COVID-19. And understanding that those individuals who are staying at these residential care facilities not only have to deal with the fact that COVID-19 could be transmissible, but certainly when you bring in somebody who has to take special care because of dementia related symptoms, that's an extra layer of attention that the residential care center must also pay close attention to. So there's a number of steps that you have to take into account. For example, such as before the visit, check the community's visitation policies, because that likely will vary from place to place. In the case of somebody who is entering these residential care facilities for a brief period of time, if that person is unvaccinated, ideally you may want to consider getting tested prior to the visit. And if this person has had a COVID-19 exposure, to please postpone this visit until after 14 days. So certainly any type of visitation should always be communicated to the responsible person at the residential care facility. Was there anything else you wanted to mention about this slide, Nicolette?
I think that, as things are ever changing, we just want to pay attention to that. I know that, there's a lot of concern right now with the different variants, and just kind of following those CDC guidelines is really important, especially in residential care. We have a lot of loved ones that maybe, have other underlying conditions, or they're also in a community type setting. So it's very possible that things are transmitted much quicker when we're in a residential setting where a lot of people are congregating. So we just kind of want to pay attention to those guidelines, especially as we're going into colder months, people are indoors more. They're also in flu season and things of that nature. So just kind of, paying attention to what's going on, and, especially creditable sources. There's always things coming out in the news and what have you. So just kind of, seeing what's being said and trying to follow those guidelines and making sure, as much as we're all kind of really, I think, burned out on being isolated, also taking into account, those vulnerable people in the population and how we can keep them most safe.
Perfect. Thank you, Nicolette. All right. So then a few more tips regarding this topic is certainly during your visit, try to follow as close as possible with these guidelines. I think Nicolette also mentioned about limiting your visit to approved areas of the residential care community. So essentially keeping, some sort of social distance whenever possible with other individuals staying at the facility. If weather allows, certainly try to use the outdoor facilities. Don't rely on the facility having a mask for you. Certainly, ideally would be for you to bring your own mask and wearing it while you stay at the facility. Washing your hands, and certainly if that's not something that you can do right away because there's nothing close by, certainly have a sanitizer in your purse, or somewhere where you have easy access to. Now, what happens when visitation is not an option? So certainly you want to keep this loved one, this loved one very close to you, and that you're in constant contact with this person, right? Because it might come to a point where you will have to use technology, right? Or communicate by phone or by video chat, things like that. So technology has actually allowed us to have this, to add this other resource to us to be able to communicate and keep in contact with them. It is very important to have constant contact, right? If a personal visit is not allowed, so for example, here it says providing the information to the staff or attending nurse, and try to communicate or follow those guidelines on how you can provide information to the staff that is looking after your loved one at a healthcare facility. So providing as much information as you can, like for example, if you can write a note and have it posted on your loved one's room. This way your loved one is able to access that note, or if it's an iPad, for example, or a tablet that you can give to this person. So if that person calls, then you can have, hopefully that their loved one can pick up your call, and then this way you can improve the communication so the person doesn't feel isolated. And this way you can use that call to essentially constantly highlight some of the things that could help this person remind some of the steps that you have provided for them. Now, at the alz.org website under /care, there are some activities at home that the association has highlighted. So, for example, creating a simple daily plan. I think, Nicolette, if I'm not mistaken, this can be downloaded as a sheet, perhaps to that a healthcare, not a healthcare, but a loved one can essentially put down a plan, and then this way make it easy to give to a patient. Is that correct?
Yes, so we have a great deal of pamphlets and information on our website. Andrew put in the chat the website that has care information. And I think it's really helpful whether you're a professional or you are a caretaker at home, a caregiver. It's very helpful to have a plan. We all kind of strive off of predictability and knowing, what we're going to do and what to expect next. And there's a great deal of information that's available you can download on that website. Also, if you would like us to mail some options to you as well, we can put in the chat our helpline information. And I know Andrew has included that flyer. Anything that you need that you'd like a tangible copy of, we're happy to mail them out for free as well.
All right, perfect. Thank you, Nicolette. So a few of the other tips here on this particular slide. Certainly keep skills and abilities in mind. So that essentially don't try to I guess or keep in mind those certain restrictions, or I guess essentially what I'm trying to say is don't expect too much from that person's ability. Here, the emphasis should be on enjoying the activities and not so much on achieving all of them. Just that's one highlight here. And the last bullet here talks about being mindful of exposure to upsetting content, whether that could be a movie or news, a particular TV show, for example. So these are the parts that I wanted to highlight here under this slide. Now, obviously, we had to take care as well of tips for stress for a caregiver. Certainly, being a caregiver is a daunting task. It's not easy, and this particular slide helps you to kind of highlight some of the points, right, where you can implement. Here, for example, it mentions about physical activity that you can do. Certainly, staying connected with other caregivers as well. There's, I think, a platform within the alc.org website that pretty much is for adult caregivers to kind of connect with each other and share experiences or share tips on how to stay stress-free or reduce that stress. Certainly, I think having that platform that definitely does help. And this is to help support one another, right? There's also here relaxation, access to resources. You have the alc.org website. In some cases, there could be support groups as well. So overall, there's a number of resources for you as a caregiver to take care of yourself as well. On the right here, it says 10 symptoms of caregiver stress. I'm not going to go through all of them here, but you can see these are the ones that have, I guess, mostly highlighted by the alc.org website. So certainly, if you recognize some of these symptoms as a caregiver, certainly make use of these resources that are provided on the alc.org website. You'll find definitely a ton of helpful tips. Certainly, there is a 24/7 helpline. So this is part of the resources that are provided by the organization. Everything here, it's free. It's around the clock. Essentially, you'll always find somebody on the other line who can provide answers, or if not, can actually point you into the right direction. This is a resource that is the person on the phone is actually somebody who's a specialist. And in most cases, I think it's somebody with a master's level clinician certification and can offer confidential advice and support. There are staff that have the ability to speak multiple languages, so don't feel that you are, that because you don't speak that language that you will not have access to some of the resources. So there you go. There is the 1-800 number. Make sure you write it down. You can also find it by accessing the alz.org website as well. There's a chat in case you don't feel comfortable, talking to somebody at that moment. So feel free to use that live chat function as well. With regards to the virtual programs that are offered, so certainly the program that you're attending at the moment, this is a virtual program. There are both types of programs. There are virtual programs and there are programs where that are conducted on site. Certainly, I think at the moment, most of the programs are virtual, but there are some in the New Jersey area that are conducted on site. So by going to the alz.org website, you can find a program that it's actually conducted on site. So that's something that you can look into as well, or you can reach us afterwards on the chat here. And I think, Andrew, if there are any questions you can regarding this particular list of programs within the New Jersey area, we can definitely provide this to you, or either Nicolette or Andrew can provide them. Community Resource Finder, Nicolette, if you would like to talk briefly more about this particular resource.
So I think next to the helpline, this is probably one of our greatest resources. So if you are on the internet and you type in the website at the top of this slide, www.communityresourcefinder.org, you can be taken to this page that looks exactly like the slide. And it's really helpful because you can find resources that we provide at the Alzheimer's Association. So in the top left corner, where it says programs and events, Alzheimer's Association, you can click and find other programs like this one. You can find early stage groups for people that are in an early stage with their care partner. You can find support groups, you can find events that we're doing, and all searching by your zip code. We have various different ways that people can get involved and join virtually and in person. But the other nice thing about this website is that even if it's something that we don't provide, one of these other categories can provide those resources for you. So if you clicked on medical services, you could find a listing of neurologists, geriatricians. If you clicked on housing options, you could find assisted livings, continuing care options, community services, maybe transportation you're looking for, or you're looking for locations that provide Meals on Wheels. So there's a multitude of resources that you may need that you can find all at this website. Elder lawyers, as I said, doctors, different opportunities in your community. And it's nice because you can have a whole listing and you can call and you can find out just by entering your zip code. And if you're not online, again, that website, that helpline that Andrew shared can be very helpful because you can call and you can say, I live in this zip code and I want a listing of neurologists or elder lawyers. Can you mail that to me? We do that for families every day that are not online. We're happy to do it, and we do it free of charge. So definitely the Resource Finder is a great opportunity for families to find resources in their community and services they need.
All right, thank you for that, Nicolette. If I'm not mistaken, Nicolette, this is another website, ALZ Connected. This is for a support group resource for those who are caregivers and would like essentially to connect with other caregivers.
Yeah, so this is like an online blog, a message board. So if you let's say couldn't get out because the weather's bad, you're traveling in another area, but you want to ask someone's advice, you want to tell someone what's kind of going on, you can connect with others through these message boards. There may be different topics that people are talking about or things that are going on. And it's a great way to get further information from others that are in the same situation.
Awesome, thank you. All right, and this takes us to the Alzheimer's Navigator website, and I think this is if I'm not mistaken, this is a tool that you talked about earlier, right?
Yes, so the Navigator can be used if you are tackling a particular topic. So if you are saying, my mom won't stop driving and I just don't know how to deal with this, you can click on driving and you can populate all kinds of information and data and ideas and tips. You can create an action plan that, how do I talk to mom? How do I even start that conversation? What are the next steps? So resources that you can use in real time that may work for your family.
Awesome, thank you, Nicolette. All right, so I guess that takes us to the last slide. And if you have any questions, I guess I'll connect you with Andrew. So Andrew, if there are any questions on the chat, perhaps you can read them and either Nicolette or myself can chip in and try to answer the questions.
Absolutely. Thank you both. If anybody does have any questions, you can certainly submit them in the chat or in the Q&A feature, and we'd be happy to answer them. A question did come in earlier and Nicolette answered it, but I think it might be useful to kind of maybe talk about, someone asked, has the opposite theory been explored? In other words, if an elder contacts COVID-19, do they have a much higher chance of developing dementia? So Nicolette, if you wanted to speak on that just a little bit.
Yeah, so there's so much research going on all different topics, prevention and long-term effects of things. And COVID-19 is so very new. I know that I had it last year, and I get chronic headaches and just different kind of testing going on. Is it related to this? Is it a sinus issue? Really trying to get to the bottom of it. Is they're just gathering so much information right now, and it's so relatively new that there is a lot of research going on. And I have heard of research studies that are particularly studying that in particular. Does this lead to does COVID-19 lead to Alzheimer's dementia? What are the long-term effects? I was just on a call earlier today and a woman was saying she had COVID-19 and it she was told it led to a diagnosis of epilepsy. So just kind of the long-term effects of things, we're really kind of just touching the iceberg because you're not in long-term yet. We're still kind of battling through this. But I know that there's a lot of research on that. Unfortunately, Alzheimer's and dementia, we're seeing that people could have a brain injury, they could have a heart episode, they could have things 20 years or more before we're seeing kind of those effects, those changes in the brain. So it is possible that research may need to go on for some time period to kind of really see long-term all the effects that COVID is having on people. There are those studies, as I mentioned, but I think as we go along, they're going to gather a lot more information and they're going to be able to tell more scientifically, yes, A, COVID does equal B, whatever that may be, whether dementia, what have you, or some kind of uptick or correlation, versus, we think there's kind of, a worthy something to explore. So I think right now there's a lot of studies, there's a lot of research going on, but I think we would have more conclusive evidence as time continues to go on.
Have you noticed any effects of COVID in terms of caregiving? I know that, sometimes it can be harder to get care, but are those effects then having, a more significant impact on those suffering from dementia?
We're seeing a lot of effects of, isolation, challenges with not only individuals that are caregiving, especially women. We're seeing, that they're caregiving, there's so much isolation, there's so many challenges going on now, and really, not being able to access fully healthcare for some time, our own health being forsaken, more challenges with mental health. We're seeing as well difficulty where a person living with dementia or Alzheimer's may have been in a residential setting that we were talking about a little bit earlier, and they were joining bingo, they were joining lunchroom activities, what have you. And during COVID, to keep everyone safe, we've kind of isolated people a little more. We don't want to congregate, 35 people in the lunchroom. And it's challenging because as we move further out of that, we want people to engage. We know that it's good for the brain to have that social engagement, that cognitive stimulation. We want people to be involved in adult day programs and different things that are good for them. But even more challenging to now get people re-engaged because they've been so used to that kind of isolation and that social distancing. I know myself, for quite some time, we've been working from home for almost 2 years now. And one day I went into New York City with my aunt and I was like, wow, this is really overwhelming because there's so many people and there was so much going on. And I really wasn't used to that environment anymore. So if you can imagine someone who, has on a smaller scale been completely isolated because they're vulnerable and we want to care for them and keep them protected, but at the same time, just re-engaging them in that, small group can be very challenging. Trying to, focus on activities and trying to have that conversation around the bingo table or poker or what have you. Really hard to follow the conversation when multiple people are speaking. So definitely, challenges we're seeing as far as the caregivers, as far as the burnout and the overwhelmingness, trying to get support and managing all the things we do day to day and on top of being in a pandemic, but also as well, as you mentioned, the people that are living with the disease, some new challenges that we've been faced with as well. And I would recommend to all those people that, may be encountering different difficulties or have further questions, that helpline is really great that Ronald mentioned. Just even if it's something that you just want someone to talk about, talk with, that understands, or you have something that you seem like this is just very basic, but I'm living it. I want a second opinion. I want to know what someone else thinks. They're a great resource. I get positive feedback every day from people that were just able to get resources and information and just someone to listen.
Okay, great. Well, I don't see any other questions, so I'd just like to go ahead and thank both Ronald and Nicolette for your time and for sharing all of this great information with us. I'd like to thank everybody for attending today. We always appreciate your patronage and hope that You're getting a lot out of our programming. Anything else you'd like to close with, Ronald or Nicolette?
Thanks for having us, always being a great partner. We hope to do it again in the spring, and I hope everyone has happy holidays and stay safe. And thank you, Ronald, for presenting. You always do a great job.
Oh, you're welcome, Nicolette. Thank you, Andrew, for hosting us. And thanks everyone for listening to these, helpful information. Have a good rest of your day and holidays.
Thank you. All right, I'd just like to close with be safe, be well, everyone, and hopefully we can see you soon. Thanks.